Dr. Richardson, holidays are coming up. Can you share what this time of year means for people living with cancer and their loved ones?
Yeah, the holiday season brings happiness and joy to people, but it can also come with, risk related to viruses that can make people sick. And so what we are, promoting is that everyone is vaccinated for the viruses out there right now, the flu, COVID-19, and RSV. And so we believe in the power of prevention, whether this is taking steps to prevent, a chronic problem like cancer or an acute problem like the flu. And we do have guidance for people to how to stay safe and healthy during this time.
And the basic guidance that you're suggesting or recommending?
Well, the basic guidance, number one, is wash your hands regularly. That works the best. Get vaccinated for the 3 viruses that I mentioned: the flu, COVID, and RSV. And if you're not feeling well, or you notice that someone else is sick, that you should, isolate or stay away from those sick people, and wear a mask if it's something that makes you feel comfortable.
Angela, I understand you're a cancer survivor. Can you tell us about your experience and what this time of year means for you?
Yeah, absolutely. I was diagnosed with breast cancer after a routine annual mammogram several years ago. I am so happy to say I'm cancer-free today. I continue to have my regular scans and tests to ensure it stays that way. But as far as what this time of year means to me as a cancer survivor, it has changed. I think having cancer changes your outlook forever. And it means a lot. It means hope, it means family, it means gratitude. I am so thankful in a new way for my good health in a way that I wasn't before. Maybe I took it for granted a little bit. But I'm also so thankful for the good health of my friends and family. My parents are in their 70s, and it makes me so happy that they are in good health, not experiencing anything. And I just appreciate it now in a different way than I did before.
Dr. Richardson, looking forward for the new year, what can you tell us about cancer screening recommendations?
Well, cancer screenings is really something that we can do, year-round to take care of ourselves. And, there are 4 recommended screening tests based on age, starting with mammography for women who are 40 to 74. That's the screening test that we recommend every 2 years. For pap testing for cervical cancer. 30 to 65-year-old women, we recommend that we add HPV tests to that every 5 years. Colon cancer screening starting at 45. That is a relatively new recommendation from last year, where the age went from 50 to 45, and a lot of people don't know that. So we're happy to be here today to share that with your listeners. And finally, it's lung cancer screening, being tested every year with a CAT scan if you've smoked heavily and quit in the last 15 years, or if you currently smoke. We recommend that you get a CT scan once a year.
Going back to the holiday time, doctor, what advice would you give to those who may be going through some health issues?
Well, first I'd recommend that whatever your health issue is, that you talk with your provider and learn as much as you can about it. Ask questions. If it's cancer, we have resources at empoweredhealth.org that you can go and look at. That we have even sheets there with questions that you should ask, things to remember. Again, I cannot stress enough about vaccines, the ones that I discussed earlier, and washing your hands. It really, really does make a difference to wash your hands frequently because that's what gets rid of the germs.
Angela, finally, do you have any advice for keeping healthy, not, of course, during just this time, but all year long?
Yeah, absolutely. I think my advice during the holidays is just to enjoy them. I'm going to try and take that advice myself this season. Our mental health is so important. And I think we all learned during COVID that being alone and isolating ourselves from others can really be damaging and depressing. But we also learned a lot over the last 3 years about protecting ourselves from germs. So keep washing our hands, to Dr. Richardson's point, get the flu shot, get the COVID and RSV vaccine, avoid people who are sick and stay home if you're sick, like Dr. Richardson suggested. And if your immune system is compromised from cancer treatment or another illness, I would avoid really large gatherings and wearing a mask if it makes you feel safer. As far as for all year long, I want to echo one of Dr. Richardson's recommendations, and that's just the importance of getting vaccinated and the importance of cancer screenings in particular. My mammogram didn't prevent me from getting cancer, but it did help me find it early when it was easier to treat. And, I think that's probably the number one reason why I'm here and talking with you today.
Thank you both so much. I appreciate it.